I would like to take this opportunity to welcome you all. I am as thrilled as Maggie is that you are here joining us today to get a closer look at what we do at the Harris School. Like Maggie, or probably actually prior to Maggie, I drank all the Kool-Aid and then I made some more for her. So I can't imagine that you wouldn't leave here absolutely in love with our program and wanting to come. But if that's not the case, if it's the case that you decide that it's not right for you, that's perfectly fine. We want to make sure that you find the right graduate program for yourself. But I can guarantee that after you've heard Jens speak, Professor Jens Ludwig, you'll be converted. You'll be a convert just like me. This portion of the day is dedicated to giving you a sense of what life is like inside the classroom. We wanted a chance for one of our faculty members to... Sorry. That was me sneaking in. That was a good breakfast. You okay?
Yes. Just a little embarrassed.
My job actually is to see to the safety and well-being of my students. So I want to make sure you're okay. Okay, good. Fridays are not a popular day for classes, and so by holding this session, by holding on MaPP on Friday, we don't have an opportunity to feed you directly into classes as they occur during the natural spring quarter. So we thought we'd try to replicate a little bit of that, give you a flavor of some intellectual correspondence with a faculty member in an academic session instead. And so we've asked Jens Ludwig, Professor Jens Ludwig, to talk a little bit to you about the work that he does in his research and also how that translates into the courses that he teaches with us. And hopefully he's going to express to you something about his own impressions of coming to the Harris School. He's been at the University of Chicago now for almost 2 full years. Is that correct?
Almost 3.
Almost 3. Sorry. Almost 3 full years. So without further ado, I ask you to join me in welcoming Professor Jens Ludwig.
Thanks, Ellen. Good morning, everyone. Welcome to Chicago and the University of Chicago. To make this as close as possible to a real classroom experience here at the Harris School, I've decided to start off with a surprise calculus quiz. That's not a joke. Can everyone get out your pencils? Now, my wife actually said that we were supposed to get snow here in Chicago, I think today or over the weekend, so I'm delighted that that didn't happen. Welcome. What I was going to do is... What I wanted to do is, before I start telling you about my own experiences drinking the University of Chicago Kool-Aid, I would start off talking a little bit about the public policy Hawaiian punch that I have drunk. So the first thing that I wanted to do is to just say how I think independent of where you decide to go to school, the first thing I wanted to do is to just increase everybody's sense that you really do want to get an MPP wherever you decide to go, because I really do think this is so important. And I wanted to say a couple things, and this will lead in to the sort of work that I do and what's been going on at the Harris School and the University of Chicago, but to just underscore the importance of what MPPs do and the desperate need in society for people with this sort of training. And I just picked one of the many examples of these massive persistent social problems from one of the areas that I work on, which is schooling. This is a graph. You can see that I made this graph up myself for the very low production values. But this is a graph that shows you the high school graduation rate for people 20 to 22 years old in 1984 and 2002. And I'm showing you the high school graduation rate for whites and for blacks. Okay? And there are a couple things to take from this graph. The first thing that you can see is that they're massive. So graduating from high school, almost every social science scientist believes, and almost every public policymaker believes, is one of the most important things that we can do to try and help people escape from living in lives of poverty, adverse health outcomes. Almost every bad outcome that you want to avoid in society is directly tied to schooling attainment. There's about a 10 to 12 percentage point disparity among young adults in 1984 in the high school graduation rate in the United States, right? And I think the other really important point to take from this picture is that there's been almost no progress on this problem over the last 20 years. Actually, I could have made up this graph to show you that there's been almost no progress on this problem over the last 40 years. Right now, about 25% of African Americans in the United States don't graduate from high school. This is a graph that draws on some data from Bruce Western in the sociology department at Harvard. This shows you, again, these are whites and these are blacks, and what I'm showing you here is the proportion of white and black high school dropouts who've spent time in prison at any point before their 34th birthday. Okay? In 1979, something like 3% of white high school dropouts spent time in prison. That was about 11% for blacks. By 1999, it was more like 7% for whites, and nearly 60% of black high school graduates, high school dropouts in the United States spend time in prison. 60%, the fraction's even higher for black males. This is all blacks. And actually, this is black males. Nearly 60% spend time in prison, right? So imagine the life outcomes for this program population. And again, this is an area where it's not just that we're making no progress, we're making the reverse of progress. Right? This is a problem that is becoming substantially worse over time. The other thing that I think is really important, I think this is highlighted by the previous two pictures, but really reinforced from being here in the city of Chicago, is exactly how uneven the distribution of these social problems are across the population. And you can see that most starkly here on the south side of Chicago. So if you were to walk about half a mile that way, that's west, right? If you were to walk about a half a mile that way, you would walk by President Obama's house in Kenwood, and then you would come to Cottage Grove. So this is an abandoned building on Cottage Grove. It used to be a food/liquor store. My 6-year-old daughter goes by this building every day when she goes to swim lessons over the summer. Cottage Grove is the boundary between Hyde Park and the nearby neighborhood of Washington Park. This is a graph that shows you some characteristics of Hyde Park in the blue bars and Washington Park in the whatever this color is. So about 17% of people in Hyde Park are living below the poverty line. The figure is about 50% in Washington Park, right across Cottage Grove. Right across Cottage Grove, we have these massive disparities in poverty. About a third of people living in Hyde Park are African American. About 98% of the people in Washington Park are African American. This is an unbelievably hyper-segregated part of the world here on the south side of Chicago. The infant mortality rate right across Cottage Grove is about 50% higher on the west side of Cottage Grove than it is on the east side of Cottage Grove. The homicide rate in 2006 in Hyde Park was about 3 per 100,000 compared to 78 per 100,000 right across the street, right across Cottage Grove in the Washington Park neighborhood. These are huge social problems that most severely affect the most vulnerable people in society. And I've become convinced that one of the reasons that we have these massive social problems and why they're so persistent is because there is currently such limited capacity in the public sector, the nonprofit sector, and the private sector to really figure out what to do about these problems. So I spend a lot of time going around talking to city, county, and state agencies here in the Chicagoland area and talking to people in DC, and it is shocking. It is shocking how desperate policymakers are to actually have some sense for what they should be doing. It really is. And I think the other really important point that has convinced me that MPPs are so desperately needed is part of the problem is that it's very, very difficult to actually know what we should be doing. The other part of the problem is that a lot of what we actually do relies on these unbelievably large and incredibly complex government agencies that are very, very difficult to actually manage. Right? So in the city of Chicago, in the Chicago public schools, the high school dropout rate is about 50%. And one of the reasons for that is this is a 400,000 student public school system. And what Mayor Daley does is he replaces Arnie Duncan as CPS CEO with Ron Huberman. And now Ron Huberman has to coordinate the activities of the 50,000 or whatever teachers and staff and central administration personnel. I don't know if anybody read the New Yorker article about the rubber room, about the New York City public schools and the great difficulty that New York City has had in trying to ensure that disadvantaged kids get decent teachers in front of their classroom. This is a pervasive public management problem that you see in almost every school system in the country. And this is not limited, it's not limited to public schools, it's not limited to Chicago. This is a major challenge for public policy everywhere. So what should we do and how do we actually get our agencies to do it? As Ellen mentioned, I thought one thing that would be useful would be to maybe share a little bit of my own experience. I was like you 3 years ago thinking about, I'd been on the faculty at Georgetown for a long time in their public policy school, and then I was trying to decide if we should come to Chicago. I'm a lifelong East Coaster. And so I thought it would be useful to just share a little bit of my experiences in the transition and my decision to come, and then I'll tell you a little bit about the sort of research that we do here. So if you go to one of the first things that I did when I was offered the chance to come interview at Chicago is I went to the University of Chicago website, and on the website it says, the University of Chicago is one of the world's great intellectual communities. And I thought, come on, every university's website says that. But it has really been shocking to me how true that is. So there are a couple things about Chicago that has been absolutely amazing. I met with the provost when they were trying to get me to come to Chicago, and he said one of the things that you will like about Chicago is that it is an open campus and it's a very compact campus. So not only do we have 8 Nobel Prize winners running around campus, but they're all within a very compact geographic area, and everybody has access to everything on campus. And that has turned out to be really, really true. That's true for students as well as for faculty. And I can tell you that when you are at lunch talking to a Nobel laureate, you can feel yourself getting smarter. Now, I should qualify that by saying you can also feel the IQ differential between yourself and the Nobel laureate, but it is attenuating at least modestly over the course of the lunch. It is really unbelievably invigorating to be able to interact with the people on this campus. So I really do feel like I feel incredibly privileged myself to be here. The other thing that I would say, my friend Mario Small is on the faculty at the sociology department here at Chicago. He was at Princeton when Chicago called to see if he wants to come, and he, like me, does a lot of work on urban problems. And Mario went through exactly the same thought process that I did, is he said, I love living in Princeton. It's very nice, it's very clean, it's very safe, but if I really am serious about this is Mario's thinking, and this was my thinking as well, if I'm really serious about trying to learn more about these social problems in the area of poverty, school dropout, adverse health outcomes, premature mortality, crime, inadequate housing, and so on. Princeton, New Jersey is not this is Mario talking now. Princeton, New Jersey is not the right place to do this. Mario, should really be on the south side of Chicago. And I lived in Northwest DC, and I sort of went through the same sort of thinking. As I showed you before, these problems are the opposite of abstract here at the University of Chicago. So we spend a lot of time thinking about these problems, but you can also see them literally by walking 7 minutes to the west or the south. So I've really liked it here. Let me give you a couple examples of what the sort of work that we do here at Chicago, and then I'll stop, and I'd be happy to take your questions or comments and just chat more about what it's like to be here. So I have been really, really interested for a long time in this question of why it is the case that almost every severe social policy problem that we have is so severely concentrated in a limited number of neighborhoods in any city that you go to, right? So, I showed you some statistics about Washington Park and Hyde Park, right? Hyde Park is about a third African American, so the statistics that I showed you imply that African Americans living in Hyde Park have vastly different life outcomes than African Americans living in Washington Park. And there's a large literature in sociology that shows us that controlling for your own personal characteristics where you live is very strongly correlated with your life outcomes. And so it's also really quite striking that if you, the crime people say, they look at their crime maps and they say, where's all the crime happening? It's in places like Washington Park. The health people say, where are all the adverse infant mortality outcomes or obesity or cardiovascular disease? They're looking at the same neighborhoods. The people who worry about joblessness are all looking at the same neighborhoods. So it's really striking that all these social problems are concentrated together in the same places, which gets you to think, again, even statistically adjusting for the characteristics of the people who live there, which gets you thinking that maybe it's something about the neighborhood environments themselves that are contributing to this. So in the 1940s, a bunch of faculty in the University of Chicago sociology department had the same observation where they would notice that when they mapped delinquency rates in different neighborhoods historically in Chicago up to that point, delinquency rates are high in the same neighborhoods. And what was really interesting to the sociologists in the 1940s here at Chicago was that patterning was true even though there's a huge amount of churning for who's living in these neighborhoods, right? So you have these neighborhoods on the south side that were originally the home to a bunch of Irish immigrants, and then the Irish, they go through the melting pot process and assimilate and then disperse themselves through Chicago, and then those neighborhoods become the German immigrant neighborhoods, and then the Germans assimilate and disperse, and then they become the Polish immigrant neighborhoods, and nowadays it's the Mexican immigrant neighborhoods, right? But it's the same neighborhoods that are always the places where you have these greatly elevated delinquency rates, which got them thinking maybe it really is something about the neighborhood. And this idea then became much more influential again in 1987 when William Julius Wilson, who was again in the faculty of sociology at Chicago, wrote a very influential book called The Truly Disadvantaged that fleshed out these ideas about why neighborhoods might matter. And so Wilson's argument was civil rights legislation that led middle-class African-American families to be able to move out of the ghetto created these concentrations of neighborhoods that basically had no role models, no social resources, and very limited ability to lobby for institutional resources in the neighborhoods as well. This basically generated the idea that neighborhood environments themselves might matter hugely. Now, this has been a very, very important policy question because public policy really shapes the concentration of poor people living together in high poverty neighborhoods versus equally dispersed. So there's something like 13% of the US population living in poverty. I showed you Washington Park is like 50% poor. So you might think, well, of course, that's the natural way things would be, but there's an alternative way the world could be, which is that every neighborhood has 13% poor people in it. It is not inevitable that all the poor people are concentrated together in the same neighborhoods. This is shaped in part by the sorts of policy decisions that we make, right? So all sorts of government agencies and policymakers are hugely concerned about whether the concentration of poverty itself is contributing to these adverse outcomes for people's life chances. Now, empirically determining the degree to which neighborhood environments actually adversely affect people in practice is very difficult because people do have some degree of choice over where they live, right? So if I observe an African-American low-income family living in Washington Park, and I'm going to use an even more extreme example, and I compare them to an African-American family with the same family income living in Oak Park, which is the very fancy western suburb where Ernest Hemingway grew up, right? If I observe, and suppose that these families look similar with respect to all the things that I can see about them in the social science data set that I have. If I see that the African-American kids in that family in Oak Park are doing better in school, I can't really be sure whether the difference in those kids' outcomes are due to some beneficial developmental influences in Oak Park, or instead to the fact that there was something about the mom in that family that led her or enabled her to move out of the inner city to Oak Park that is really, so call it mom motivation or something like that, whether that is really the thing that is driving both the relocation to Oak Park and the better schooling outcomes for our kids, right? So it's very, very difficult. It's been very, very difficult. The first study of neighborhood effects, actually, that I saw was done in London in like the 1700s, looking at health outcomes. And for hundreds of years, researchers have been trying to answer this question of neighborhood effects on people's life chances. And it's always been complicated by this, what we call the selection concern, people selecting into neighborhoods. So for the past 15 years, I've been trying to learn more about this question by working on a U.S. Department of Housing and Urban Development experiment called Moving to Opportunities. So you might think, how can a guy who looks like he's 18 have really been working on a research project for 15 years? And the answer is actually simple. I started when I was 3. So let me tell you a little bit about the Moving to Opportunity experiment, because I think that this might be, even if you decide not to come to the hair school, I think you will find the MTO experiment really, really cool. And if you come, you can hear more. So MTO was sponsored by HUD because HUD thought it was really crucially important for them to understand the causal effects of neighborhood environments on the life outcomes for disadvantaged families. So starting in 1994, they enrolled 4,600 public housing families living in some of the worst neighborhoods that you could imagine in 5 U.S. cities, listed up here, one of which is Chicago. Almost all of the families in MTO are minority. What was really striking about this is that crime was, so economists looked at MTO and said, clearly these low-income public housing moms are going to sign up because they want to get to better jobs. The education researchers said, no, it's clear that they're going to want to sign up to relocate out of public housing to get to better schools. The health people said, no, it's to get access to better healthcare facilities. You can sort of see the pattern. We did a survey of the families at baseline, and far and away, 75% of the families said crime and safety was the #1 reason they wanted to get out of their public housing projects, which is not surprising because the baseline surveys also found that about half the households had had someone victimized by crime in the 6 months before the survey. So think about that. 50% of households were victimized by a crime over a 6-month window. Imagine what your life is like when you are living in an environment. These are all moms with kids. Imagine what your life is like when you are living in a neighborhood where you have a 50% chance that someone in your home is going to be victimized by a crime every 6 months. Right? So the other thing that MTO has really taught me is that the way we structure public policy curricula and the way we structure government programs is we think about there being like the health side to the family and the public safety side to the family and the schooling side to the family and the so on and so on, right? Imagine what it's like to try and get a job when you've got to leave your kids unattended a bunch of the time, when you've got a 50% 6-month victimization rate. Imagine what it's like to try and focus on schooling attainment when you've got a 50% victimization risk every 6 months. Okay, so all of these things, MTO has really taught me that all of these things that we treat as separate are really like the same thing in the lived daily lives of these families in some of these most distressed neighborhoods. So what MTO did is they enrolled these families, and then they basically flipped a coin and randomly assigned some families the chance to relocate, get a housing voucher, and move to much lower poverty neighborhoods, and other families stayed behind in public housing. So this is like, when you go to the you're all too young for this, but when we all get older, we'll be going to our cardiologists, and the cardiologist will be prescribing Lipitor for us, which is some sort of cholesterol drug, and I think, the reason that we're confident that, when the doctor says take Lipitor, it'll reduce your cholesterol, the reason that we're confident that the doctor is right is because the FDA has required Merck to do a randomized clinical trial to test the effectiveness of Lipitor. They take a bunch of patients in, They randomly assign half to get Lipitor, half to get a sugar pill. Because of random assignment, the two groups of people in the Lipitor and the sugar pill group are identical with respect to all health risk factors, except for the fact that the one group gets the Lipitor and the other group gets the sugar pill. So that's the only difference between the two groups of people in the Lipitor trial, which means that we can be very confident that any differences in cholesterol and other health outcomes are due to the receipt of the Lipitor itself. MTO does the exact same thing, except instead of Lipitor, we are testing the effects of living in a very distressed neighborhood environment. All right, so we can really, for the first time in the several hundreds of years of research in this area, we can really be confident that we are identifying the causal effect of the neighborhood. This is one of the Robert Taylor homes projects that used to be located on State Street, which is about a mile west of where we are right now. This is a picture from the inside. I just want to make three observations about this picture before I tell you a little bit more about MTO, and then I'll stop and take your questions. There are three things to notice about this picture. I don't know, can you all see that okay? The first thing to notice about this picture is that it is no accident that these kids are African American in the picture. Right? When you go to these high-rise public housing projects on the south and west sides of Chicago, they are literally like 99 to 100% African American. Again, this is not an accident. The U.S. Supreme Court ruled that the Chicago Housing Authority was engaged in racial discrimination too. This is not like all the poor African American families are saying, we are desperate to live in all black public housing high-rise projects on the south and west sides, right? So so the racial segregation is a really important feature of these high-rise public housing projects, driven in part by policy decisions. The second thing that I want to point out is, I don't know if you can see from there, but this is supposed to be a window for a Robert Taylor Homes apartment, and I don't know if you can see it, but it's actually boarded up with plywood. So you might say, why is it boarded up with plywood? And having been inside the Robert Taylor Homes and talked to the moms, every Robert Taylor Homes apartment I went into was boarded up with plywood. And I originally thought, why doesn't the CHA just fix the windows when they get broken? How do the windows get broken so often? But in any case, why don't they fix it? And what the moms tell you is that they're boarded up for safety. Right? People are breaking in through the windows so often in these high-rise public housing projects that the moms would rather have no light. So you go into these units, and it's bare cinder block walls with roaches crawling around everywhere, with bare light bulbs casting light in this very bleak apartment, and no natural light at all because the moms are so afraid of crime victimization. And now here you are raising these kids in this environment. Okay? And the third thing that I want to say about this picture is, you might also notice, again, I don't know if you can see this, but you might also notice that there's fencing up over this. So this is an open air hallway that connects the units all the way up, right? So right in here, these are the open air hallways that connect the units, and that's what we're looking at here. When the Robert Taylor Homes were originally built, the fencing only went up this high. Can anyone guess why they put up the rest of the fencing? So it's floor to ceiling chain link fencing on every one of these open air hallways. Any ideas? Yeah. Any other? So you're thinking you've been reading too many Cornell articles in the New York Times.
Desperate conditions lead to desperate actions.
So that's actually a very good hypothesis, which is not the story that I heard from the CHA, but that's a very plausible hypothesis. It's actually interesting that suicide rates are much lower among African Americans than whites in the United States, despite the fact that the social conditions are so disparate. Yeah.
Despite the fact that there's a fence halfway, people still taking the initiative to break in, or safety of the children?
Any other guesses?
Maybe with crime victimization, people are being pushed, or maybe some people are falling.
Any other? There was actually one very tragic story. I don't know how many people read Our America about a kid being pushed out of a window of a public housing like a 7-year-old kid who wouldn't steal for 2 10-year-old kids got thrown out of a top floor window of one of these high-rise projects. That's not the reason. The reason that they did it is that people were throwing stuff. So the only public space that you have in the Robert Taylor homes is the common space at the base of the housing projects, and people would throw bottles and God knows what else off the thing. So the CHA decided we're going to stop that problem by putting floor-to-ceiling chain link fencing, which was successful in fixing the problem, but clearly adds to the supermax aesthetic of life in these projects, right? So it is this is all to say that it is completely natural to think that the sociologists are absolutely right. You might think MTO is not even an interesting study, right? Because you would say it is so patently obvious that growing up in one of these neighborhoods would have such detrimental developmental effects on kids that you don't need to do a big randomized controlled experiment, right? Now, what is really shocking then is that when we go out and we do this experiment and you follow the families up for 5 years, you do see major changes in violent crime victimization and defending for the kids and the families. You see massive improvements in mental health in particular, not surprising given what it's like to live in these neighborhoods, sort of consistent with your hypothesis before, and yet very striking. So the treatment group here is moving to census tracts with poverty rates below 10%. These are like massive changes in neighborhood quality, and yet absolutely no evidence that the earnings for the families, for the adults, or the test scores for the kids are changing. Absolutely no evidence of those changes, right? So I think one of the lessons that MTO has really taught me is that the world is so a couple things. One is that the world is an incredibly complex place. The second thing is that our theories about the way the world works are very, very limited, and empirical data is absolutely crucial in the formulation of good public policy, and that it is extremely difficult to do what we all want to do and substantially improve the life chances of these families who are among the most disadvantaged families in the society. So let me, in the interest of time, let me just close with one last thought, and then I'll stop and take some questions. So one of the other things that's very exciting for me to be here at Chicago now, given that this is the sort of work that I do, is that President Robert Zimmer, president of the University of Chicago, announced a year or two ago that he had the ambition to have the University of Chicago redefine how a great research university interacts with its ambient city. And so the university now is launching this university-wide urban transformation initiative, of which the Harris School seeks to become a major part. So we have our own urban policy initiative that is going to try and capitalize on the university initiative in this area and build on a lot of strengths that the Harris School already has in social policy and health and governance. The thing that I find really exciting about this is that this is going to provide even more opportunity for faculty and students to interact with other units on campus. So, for instance, for MTO, I've been working with someone in the, I'm part of the long-term follow-up team for MTO to see what happens to families over the long term and to see whether outcomes are more beneficial over time. There's this big urban health initiative in the medical school that's underway, and for MTO, I've been working with a doctor in the medical school to get blood samples from the families in MTO to learn a lot more about health impacts. There's a major urban education institute that is a big focal point for the university as a whole. I've been working on with someone in the sociology department on MTO for that. There's lots of work going on in public housing and crime around the city. We have faculty and students working with government agencies all over the city as well. I think this is just a very exciting time to be here, working at the different agencies and learning about how to address these unbelievably important social problems. This seems to me like just great training for working in any sector you can think of at any level of government that you think of. Chicago is this unbelievably great laboratory for learning about how to about these problems and how to fix them. That I think generalized to, even if you're going to go to DC, I think a lot of the experiences you'd get here in Chicago would be super relevant. So let me stop there. I think we have about 5 to 7 minutes for questions.
For sure.
Okay. Yes.
I don't know if another panel will do this later, but can you talk a little bit about the core curriculum and then where the opportunities are for students to get involved in maybe more specific areas of policy, like the one like research?
Yeah. So the core curriculum is the core curriculum at most public policy schools. I don't know if this is the way that I think about it. I don't know if this is the way that I think about it is that the core curriculum at like the top 10 public policy schools in the country are correlated at like 0.95. You get some economics, you get some statistics, you get some public management training, and some understanding of the political process and so on, right? And so our core curriculum looks a lot like what you would see at the other top public policy schools. Usually the way students then get involved with some of these research activities is towards the end of their first year, you start to get an opportunity to take elective classes with faculty, and you are obviously not like throwing a dart at the course curriculum. You're choosing an elective that you're interested in. So Isaac Paul Hammond, for instance, is a first-year student at Harris right now. He took my crime policy class in the winter quarter, and then he came by my office and said, "Do you have any research stuff going on that you need help on?" And so I've hired him, and he's helping me to do a project with the Nashville Police Department to understand more about measuring. He's doing some stuff on MTO, but he's also helping us work with the Nashville Police Department to learn more about how they can do a better job in improving public safety. Yeah.
I wanted to ask, in your courses, I'm sure this probably varies in different professors' courses, but how do you structure, is it mostly research and paper writing, or research papers that the students are writing, or tests, or how's the actual, how do you grade and all, how's the class structure?
So there's a huge difference, as you can imagine, between the core courses. We really need to make sure that you get some core, clearly defined core competencies, and then the electives. My own thinking about the electives, I've mostly taught electives since I haven't been here super long. So while I've been here, I've mostly taught electives. And my thinking about the electives is that it would be cheating the students to make the elective classes just reading classes. You guys are all smart enough to go to a library and find a bunch of papers on crime. And the real value added of the elective courses is to push you to use the core skills that you get in the core curriculum in this particular policy area. So to reinforce the core skills that you get. So we spend a lot of time thinking about, do we know that increasing the prison population in the United States causes crime to go down or not? And even if it did, would that pass a benefit-cost test? And what are the other collateral consequences? What I've just described, those are questions about public management, about benefit-cost analysis, and about program evaluation and statistics and econometrics, right? All coming together around this hugely important question of mass incarceration in the United States. And what I ask the students to do is to write 4 3-page policy memos over the course of the quarter. So like on mass incarceration, the students had to write a 3-page memo to Governor Schwarzenegger in California. If you've been reading the papers, you know that state is a disaster. And they have to cut their prison population. I say that in the nicest way. It's true, though. It's a total disaster. They have to cut their prison population from 150,000 to 100,000 people over the span of like 2 years. And so the students had to write a memo to Governor Schwarzenegger to say, this is what I think is the least socially harmful way to cut the prison population by 1/3 over 2 years, based on the readings that we did in the class.
Follow up to that, have any of your students ever been able to publish any of their memos or any of their papers? Or are there opportunities as a student? I know that we probably won't have a ton of time for it, but to get any of our work actually published. So
usually, that's a very good question. So we have a student policy journal here at Chicago, which lots of students publish in. One of the students in my crime policy class wound up sending their memo to the Vera Institute in New York City as part of this. And I think it's really the interactions with the faculty and when the students start working with the faculty on research projects, that's the place where you really start to get lots more publication opportunities. So, am I getting the hook from the group in the back? I am. We've got to. Can I take one more question, or are you really going to pull out the huge cane? And one more question. Okay. Yes, sir.
You hear a lot about the school being theory-based. Can you kind of elaborate on kind of what that means for students? So what does that mean for the school to be theory? So what's the way to think about this? I'm just trying to think about that in the practical sense when we get out into the field and how we're going to.
You can imagine there being like a triad of things that one would do in a public policy school, right? There is theory, there is facts, and then there is experience, right? And I actually think that facts are among the least useful things that we can teach you because our understanding of the world is changing, and the world itself is changing over time always. And so this sort of goes back to the point I made about the electives. If all I do is have you read a bunch of paper and learn a bunch of facts, in 5 or 10 years that will be totally useless. Your entire human capital will have decayed, right? So that would be not in your best interests. So I think the theory, I wouldn't say theory, I would say developing core analytical skills that the value of which will not decay over time, right? How to think about public policy problems is the most important thing that you will get out of a policy education. It is true that the coursework here does not involve a lot of going out. Most of our courses do not require you to go partner with an agency, but there's a huge mentorship program here at the Harris School, and almost unlimited opportunities to work in local nonprofits and government agencies while you're here as a complement to your classroom experience. And so, it would be very easy to get out of the Harris School and not have any practical experience if that's what you chose, right? But it would be almost impossible to get out of the Harris School without practical experience if that's something that you wanted to get out of your education. That's the way that I would think about that. So now the red hook is coming out. Thank you all so much for coming to visit. I'm going to be at lunch too. I'm delighted to talk to you all. Thank you.